Okay. And dry mouth can cause oral candidiasis. Now, what is oral candidiasis?
Tongue is white.
But what do you think it, well, have you heard of thrush? Thrush, yeah. And that's kind of like a yeast infection in your mouth. And that can occur across all age ranges. You know, babies get that too, right? You've seen babies have that. When the milk just sits there, they start getting that because the bottle is always in there and it's pooling in the mouth all the time. So that can happen across all age ranges. Babies, middle-aged people, young folks, as well as older people. Because sometimes older people don't have the dentures in, or the dentures might not be fitting properly in the corners of the mouth. Is that?
Is that like the same thing with like somebody talking like they got that like little white cells on the corner?
Yeah, but that's, yeah, from the dry mouth. Yep. It happens. Happens to me. All right, dry mouth. Drying irritates the tissues, and then having a dry mouth makes it susceptible to tooth decay and infection. Because having a lot of saliva in your mouth keeps things moist and keeps things keeps the bacteria really from having the opportunity to sit on your teeth. All right, cough syrups full of sugar, or people who have to take liquid medications. A lot of times when y'all come to the dentist's office, then y'all say, I can't swallow pills. So then we have to do a liquid medication, or y'all, a lot of times people have to take cough syrups and things like that. But the liquid medications have a lot of sugar.
So it's better to take pills than liquid?
I don't really want to quite say it that way, but if you have to take liquid medication, then you just have to do what you have to do. But the liquid medications do have a lot of sugar in it. Yeah.
Maybe.
I know. I feel like what am I doing? Okay. All right. And like we talked about before, having a dry mouth and other conditions in the mouth can cause cavities. Sometimes cavities can look like this. But if you do have cavities that look like this is fixable, right? You just gotta go to the dentist. This is totally fixable. Sometimes people, when they brush their teeth too, they just kind of, they just kind of brush it straight across here, and they're only getting those surfaces right in the front clean, and they may not be directing that toothbrush right into the gum line. So then all these areas right near the gums are getting cavities because those areas are being missed. But this can be fixed.
What's that stuff called again? Don't it start with a C, like when it's around the teeth, like on the top?
Like if you got a cavity up here, just caries.
They got that white stuff.
Calculus.
Oh yeah.
Yeah. Yeah, that's good. I didn't know you knew that. And then sometimes you have cavities on your back teeth. Does anybody have a cavity on their back tooth?
Y'all lying.
Nobody in here has a cavity? That's good. Oh. Raise your hand if you proudly have a cavity. Exactly.
I know I got it.
Come on. Nobody has a cavity here?
It's because so.
Oh, no, hold on. Let me switch. Raise your hand if you have a cavity on your front tooth. A front tooth. Any front tooth.
Mine's in the back.
Side tooth. No.
I'm
All right, no prizes. No prizes.
Facts, my cavities got filled.
Okay, sometimes you can get a cavity or a stain on the front tooth. And again, my purpose for this part was just to say that these things can happen and these things can be fixed. Right? Hello? These things can be fixed. Now, this is, again, we were still talking about medications. So some medications called, who want to pronounce that? Some medications called
Bisphosphonate.
Tell me how easy. Tell me how easy.
Bisphosphonates.
Bisphosphonates.
Right. Some medication. I can't wait till y'all go home with your packet and explain this stuff to your family. When some medications called bisphosphonates, they're used to treat cancer.
Hey y'all, can we pay attention to Dr. Brown, please? She's taking the time out of her schedule to come speak with y'all.
These
Appreciate
medications are used to treat cancer. But that's why when a person has to start getting these type of medications, we encourage them to get all their dental work done prior to these types of treatments. Because once that medication gets into your system, it stays in your bones for months and months later. And then once you get an extraction done, the area is never really healed, or it takes a long, long time. This is a possible complication. But it's well studied and it definitely happens. The areas don't heal. So, osteonecrosis is what that's called. What do you think that means? What do y'all think osteonecrosis means? If you had to break it down. Osteo meaning bone, necrosis meaning it dies. So the bone dies. Isn't that crazy? Okay, and so also in order to keep your mouth and therefore the rest of your body healthy, you have to do what?
Stop smoking.
Stop smoking.
How many of y'all in here smoke?
Exactly. You knew that was
I have a
coming.
question. I don't smoke, but I have a question just like.
Oh, I was getting ready to say, dang, you're asking all them questions. You
Take
start
crap,
smoking.
right?
You don't smoke.
He smokes.
I'm playing. I
She
smoke
definitely-
straight nicks.
I don't know what that is. Okay.
Vape.
What's the name?
Like,
Vape.
that go for like weed too.
What's that?
Like marijuana.
Yeah, I'm gonna get to that. Yeah, but what grade is this?
I'm a sophomore, so like,
This is ninth grade.
yeah, it's not good. I'm a sophomore.
And you got smoke?
Who said that?
I thought y'all was cool. All right.
I'm too
So,
young for school,
okay.
that's why I don't ever come.
Okay, interesting facts. Pay attention, smokers in the back. One study found that smokers are 4 times more likely than people who have never smoked to have advanced gum disease. I don't know if you know, but once you have gum disease, that means your teeth can fall out.
Y'all quiet.
That's the first time I got quiet. I don't know if you know how crazy that would look, but you want to be smoking and you having your teeth falling out, that's fine too. There is also a significant link between smoking, oh, that's what I just said, smoking and tooth loss. Only 20% of people over the, I can't hear. Only 20% of people over the age of 65 who have never smoked are toothless, while 41% of people over the age of 65 who smoke daily are toothless. So the point there being that if you smoke, you're highly likely to lose your teeth. Okay,
What if you don't smoke daily? It's like still happens.
yes, I think just the fact that you're introducing that chemical into your lungs and into your mouth.
See now, I ain't never seen that before.
What, this one right here?
This look like a mini condom.
Right here, right? Right. Now, because some people think that they're doing a little better job if they use smokeless tobacco. Anybody in here use smokeless tobacco? Also known as snuff. Come in a little round can. I think you squeeze off some and put it in your, just let it sit there, and I think you just suck on it for a little while. You know what I'm talking about? Does anybody use that?
So,
Or, I'm sorry, does anybody have a friend that use that?
I hope none of my
my
friends.
uncle used to do that.
Yeah, and then you see them just spitting throughout the day because they suck on it and then the juices just spit it out. Well, anyway,
You do that?
you guys might know what I'm talking about though. It comes in a little round can.
Yeah.
All right. Again, just take that packet that I gave you and just make sure you be responsible enough to teach somebody else about this, because your class is the only class I'm coming to talk to. because they told me this is the good class. So I'm talking to y'all, and I know y'all gonna be responsible in passing this information along, right? So 1 can of spit tobacco delivers as much nicotine as 60 cigarettes.
Dang.
Dang.
Ain't that crazy? That's why this is happening.
Dang.
You see this?
Oh, y'all already had y'all.
Let me take a
See that? That's not funny.
If you like
That's
this,
not a laughing matter.
I like
More importantly, the chances of developing oral cancer increases with smokeless tobacco as much as 6 to 28 times. All right, moving right along. Oh, all right, now we can take a break from that bad picture. So, these used to be my kids, Teddy and Muffin. What kind of dogs are these? Does anybody know?
The one like tall right there.
Nope.
Nope. They're like Sheilandice right there.
Jack Russell Terriers.
She just
Yep, long-haired one and short-haired one. But now I replaced them with my real kids.
dang.
Teddy and Muffin Part 2. Just as bad. Just as much work. Okay, so, now we explored those contributing factors, and we're gonna move right along. I'm about to kick it up a notch and go a little faster. All right, diabetes and oral health. Does anybody have diabetes? Diabetes. Okay, diabetes. All right, you can read these things.
If y'all don't stop
But
throwing that ball, I'm
there
coming to
is
take
an association between
I ain't gonna teach you, gotta stay sick.
having a healthy mouth and diabetes. They kind of go hand in hand. All right, so you never heard anybody call diabetes like sugar or blood sugar because your sugar is high or something like that? So basically having diabetes, having a high blood sugar, you have that concentration going on in your mouth. And tooth decay, guess what? What do they like to eat? Sugar. So you have a high concentration of sugar in your mouth and in your body. Those cavities are going to be in your mouth and they're going to eat that sugar. And the byproduct that they make is going to be on your teeth and make holes in your teeth.
Don't you get diabetes if your body can't produce insulin?
Type 1 diabetes, yeah. Yep. You got that right.
So, if you but like, I seen something like they had to use a drill to get inside the tooth and clean all that, and then take the like the I forgot what that stuff is. Like the what is it? Like the sensitivity thing.
The nerve.
Yeah, the nerves, and then they take that out, and then they fill it back up with some gel, and yeah, that's all.
What, that's what you saw somebody do?
Yeah, I forgot what it.
That might have been a root canal you saw, sound like. And this is the other word you asked me about right here. Yep.
I saved it.
Also known as this. Also known as tartar. You know a lot of stuff. All right. Gum disease. Okay, there you go. Okay. Have the dentist ever stuck this type of instrument down beside y'all's tooth before?
Yes, they have.
There you go. Fun times. Okay. All right, and then there's also a link between gum disease and having a healthy heart as well. And same thing like what you touched on before. Does anybody know what plaque is made of?
Oh yeah, that's what I was trying to say.
Plaque.
Oh, okay.
It's like the food bacteria, and it's just sitting in your mouth.
That's right, bacteria. And it continues to multiply, and it's sitting right there in your gums and all around your teeth. But like I said before, the teeth can become loose and sometimes result in tooth loss. And this is what we were speaking about before. What did you call this? You said this was what? Yeah, plaque first. It's plaque when it's soft. You know, you take your fingernail. I know y'all ain't gonna agree now. But you take your fingernail, you can rub it across your teeth, and you look at your fingernail, it's soft, yellowy looking stuff on there. That's when it's plaque. That's when you can brush it off. Once it hardens up, when you bring your head down like this and look behind those lower front ones,